Well, hello, folks. We are at 11 o'clock now. I want to kind of keep listening. It's kind of like knowing when the popcorn is done in the microwave. When the beeps stop every 2 seconds, then we know we're probably pretty good. So, still hearing those come in. So we'll just give ourselves another minute before we start. Just want to let everyone know we will be recording this meeting so that we can upload this training for folks to be able to view afterwards. Just full disclosure there that we are recording and having transcription around this, as well as closed captioning. We do remind folks that we're going to have a lot of attendees on the meeting. Best option is to use chat. We will take questions in the order they are received in the chat. But if you would like to ask verbally, we can certainly accommodate that. Just make sure you have a hand raised there, and we'll try to be able to give you the opportunity to unmute and be able to ask your question verbally if you need to, or to add more clarification if we need that. Outside of that opportunity, though, please make sure that you are on mute so that we don't pick up any background conversations that you may be having during the meeting. Okay, well, let's go ahead. I'm still hearing some beeps, so we'll probably just give it another 30 to 60 seconds, but we'll go ahead and flip on over and talk about our agenda for today. Not an extensive agenda, but we do have a lot to cover. We will be really going over. We did an intensive around the changes for the 2023 application earlier in the year. We want to revisit some of that just to remind you of the changes that are in the application. We're not going to hit those in a ton of detail, but we do want to make sure you're still aware of those. They'll be included in the slides. You'll be able to see those afterwards, as well as in our summary of changes documents. But we will spend just a few more minutes again touching on the new measures that are in the program, some best practices as well as our new measures. Just make sure you're clear on the expectations around those new components in the program. And then we'll dive into the meat of the meeting for today. I'll be handing over the presentation to our friends and colleagues at Public Consulting Group, who are going to take you through the training on how to utilize the portal. There's some updates there. I want to remind folks each year kind of best practices around using that. And then we'll actually wrap it up with a live demonstration as well. So we'll look at some screenshots, we'll go into a live demo, and then we'll wrap up with any questions that you may have around that functionality around the portal. With that, let's go ahead and dive in. Again, with the 2022 application, we maintained like a narrative focus that was characteristic in 2021. We started to revert some of our quality metrics that allowed homes to demonstrate high quality care. For this 2023 application, we're continuing to remove that language that's specific to the pandemic throughout the application and reincorporate quality metric components. This presentation today is going to detail the specific changes that have been made in the 2023 application, and again, we'll go into a little more detail around the new measure components. So what changes do we see for 2023 that you need to be aware of as you go into complete your application here between now and the end of February? One place right off the bat that's kind of new is around the prerequisites, particularly related to the resident and family satisfaction survey. So for 2023, the application is going to ask you a couple of other questions. Don't fret here because you will not be able to move forward unless you answer these. So we've got some error checking in there to make sure we do get answers. Really no changes substantively in terms of the requirement, but what we do want to know is the name of the survey vendor that you are using to complete your resident family satisfaction survey. Who is responsible for administering that survey? What we mean by that is it staff from that vendor? Is it your internal staff at your home? You're using a vendor survey, but your staff are actually completing that survey, or some other? And how is that survey administered? Meaning, is that done by phone? Is that done in electronic means? Email? Is it done through paper? Is it done through other in-person interviews? etc. Those are not mutually exclusive, so you can be able to select all that apply there if you are using more than one method to do your resident family satisfaction survey. So make sure you have that information available, include that as part of the prerequisite. That'll move you right through into the application. In terms of the quality of life measures, there have been some changes there. There are changes in enhanced dieting. Really, it's around removing that language around the pandemic. So you're going to see a lot of that as I go through this. I'm not going to go through this in a ton of detail here. Again, it's in your summary of changes document. You'll have these slides and this recording available after this to be able to review this. Just to keep that on top of mind, there are minimum requirement changes in enhanced dining. There are minimum requirement changes, again, in connection and meaning. Also, the points available have been adjusted slightly. Measure 5, person-directed care. Again, removing that language around promising practices and opportunities during the pandemic. Trauma-informed care. This is a measure that has a new piece. We'll talk about this a little bit more detail in just a few moments, but an additional minimum requirement here. So if you've got kind of how you've approached trauma-informed care in the past around answering this survey, and your application here, make sure you pay attention here. There's a little bit more that's required for trauma-informed care this year, so make sure you don't neglect that when providing your responses here. It's also worth an additional point this year than it was last year. Physical environment, we have removed language around the impacts of social distancing. Consistent assignments, remove language around promising practices for the pandemic. Also, slight reduction in points there from 5 points to 4 points. Measure 14, equity is a new measure in the program. We'll talk about this in more detail in just a few moments, but make sure you're thinking through this and prepared here. It's early, it's the first time we're doing this, so it's really around, that the home is doing something around this. We'll talk about this again in more detail in just a few moments. There are 2 points available for this measure. Isolation protocols is also a new measure we'll talk about in just a few moments. Make sure you're paying attention to this. This is a new piece, so kind of moving from some of that narrative we talked about pandemic, really talking about that environment where we do have continued situations where folks are going to be in isolation protocols. We'll talk a little bit more about what that looks like in just a few moments. Make sure that's top of mind for you all, but those are new pieces you need to be aware of as you're completing your application this year. As we switch over to the quality of care set of measures, there are some changes there. Reducing avoidable hospitalizations had been suspended in the program in previous years during the pandemic. That is now back in the application, so make sure you do have the data ready for the reducing avoidable hospitalizations. And this measure is going to be worth 3 points. The QMs, always been in the program, still there. Still requires a narrative around your 3 highest percentile QMs. And we award points based on the home's 5 best score. We get information on all 8. We look at your best 5 scores, award points on that. We have reduced the points in this. It seemed like it was really heavy in terms of folks' performance in the total program, depending on how you performed here. So we've reduced that burden a little bit. Still a very meaningful measure, still the most meaningful measure in the program, but it's allowing us to put some emphasis in those other areas like isolation protocols and equity. Another significant change here, the bottom tier, 50 percentile and below, has been removed, is now scored. You get 1 point for being in the 40th percentile, 2 points for the 35th, 3 points for the 30th, 4 points for the 25th percentile or better. Talk about a few best practices we want top of mind as you head into this application period. Around enhanced dining, places where we saw folks lost points, was really around that facility assessment and how it's used to develop menu options. So we're specifically looking for how the home uses your facility assessment. Use those words, reference that, make sure you touch on that as you move through here, and how you're using that information to develop your menu options that reflect the home's unique population. Trauma-informed care. Again, some places where folks lost points even previously without the new data element was how are you using, there's 2 pieces here, 6.2 and 6.3. It's important to understand the distinction because this wording looks similar. 6.2 is really that macro level. So how are you using information and data from your facility assessment, that macro home-wide kind of information, as well as other assessments you're doing in your home and other means to influence programming and staff training. Again, that's from the macro level. How are we looking at our whole population from all the assessments that we do to understand how we're going to develop programming and staff training? And we want you to include a specific example of how that's done. That's that macro look of how you're using assessments to understand trauma in your home. 6.3 is more the micro level. How are you using data and information around known trauma from your facility assessment or assessments you're doing with patients or other things in your home to recognize trauma, develop an approach, and alter the care plan for residents? So it's not just around programming and staff training at the high level of understanding all of the dynamics in the home, but how are you using that same type of information on a patient by patient level? And then we want a specific example of how you've been able to do that to alter a care plan for one of your residents. So remember, 6.2 is macro, home-wide. 6.3 is micro level. There is a distinction there. They're not the same question. Transitions to care. We are looking for the name and contact individual of information of the individual at the local agency responsible to be the liaison between the nursing care center and the agency for community placement referrals. So we want that individual from that community agency, that local agency, a person's name, contact information, and the name of that person at that local agency. Not a general hotline, not a 1-800 number. We want you to identify your liaison, someone that you know is a contact there. Taking that just a step further than a Google search. Under antibiotic stewardship, infection prevention and control, we understand that Section 3 for the CDC is optional. For the pay for performance program, though, it is a requirement. So we say complete and submit only sections 1 through 3 without the needed attachments. So we don't need those needed attachments that are part of that CDC reporting of the CDC Infection Prevention and Control Assessment Tool. Section 3 is listed as optional in the CDC tool, but is mandatory for the Colorado Pay for Performance program to earn those going over and above points. Make sure you do sections 1, 2, and 3. For behavioral health care, we do want you to submit the name and contact information of an individual at your regional accountable entity that's responsible to be a liaison between the nursing home and the RAE for behavioral health services. So this is more than going to the website, looking up your regional accountable entity and seeing a referral number or a general contact 1-800 number. I want you to be able to establish a relationship, get a contact name and information. If you're having troubles there, certainly reach out. We can help. But we want you to establish that relationship, not only so you know how to make a referral, but that you actually understand the services that are available. And so that you have an individual that you have as a contact there that can inform you around the services that regional accountable entity provides. Let's take a few moments and spotlight some of the new measures so you feel confident as you move into your application. Under trauma-informed care, so this is a new minimum requirement. So still the measure that has historically been there in terms of understanding known trauma, past trauma for your residents is very, very important, still in place. There's now a new minimum requirement that then also wants you to recognize trauma currently experienced in the home. We've learned a lot of lessons here throughout the COVID pandemic. So you must describe the initiatives and training around current trauma experience in the home, specifically related to grief management, coping mechanisms, compassionate care, managing trauma-related stress, and building resilience in staff and residents. So when we think through that, we've got a list of best practices here. We have some resources for you, but make sure you don't just answer like you have in the past, but that you stay aware that there is a new minimum requirement here that you have to talk about initiatives and training around current trauma experience in the home that you did conduct over the last year. Equity is also a new measure for us in the program this year. Pretty straightforward. We're having a little bit of a lower bar here because it's the first year. So you're going to be awarded points if you're implementing trainings and or initiatives that increase equity, awareness, and sensitivity for both residents and staff. So we're not going to be overly prescriptive here. We're not going to say you have to have an EDI committee or that you have to do a specific training, but you need to do something. You need to have initiatives in your home that are showing intentionality and awareness around equity. Examples for initiatives: are you having inclusive conversations as a meaningful intentionality around how you're approaching communications in the home? Have you established an EDI committee, an equity, diversion, and inclusion and access committee, and do you have a yearly action plan? Have you been implementing initiatives around equitable decision-making processes with residents? Have you been implementing specific initiatives against ageism or ableism and or gender identity and sexual orientation-based discrimination? Examples for training are racial and ethnic disparities and their root causes, best practices for shared decision-making between providers and patients or residents, implicit bias training, ageism, ableism, gender identity, sexual orientation. There's opportunities here for education with residents, for staff. We're kind of leaving that open-ended for you all. We have resources that are available within the application. Obviously, if you're looking for others, reach out. We'll be able to help you with some resources around where to be able to look for some trainings there as well. Initiatives, trainings, do both, do one, do the other, but have some intentionality around equity. We're going to continue to evolve this measure over the next few years. So we want you to get you started on the right foot forward here in 2023. Speaking of which, there's a training. I think it interferes with this, so we'll try to wrap up as best as we can here today. But there is a training happening today around equity issues in nursing homes. So if you have a chance to attend that, or if we go a little over, I think there'll be a recording of that a little bit later. We do have some best practices here that you can reference. Make sure you take advantage of those, take a look at that, and be able to report on the efforts that you had over the last year. Isolation protocols is also a new measure for us. Homes should have extensive isolation protocols in place to protect their community. A lot of this is required, federal requirements and state requirements around this. But what we're focusing on in the pay for performance application is while you're in quarantine or in that isolation protocol, residents should be receiving consistent quality of care and maintaining their quality of life. And that's the P for P aspect that we're focused on here. Communication with family or other residents, food, mental health, physical health, other types of things that you are putting into place to make sure that in addition to those requirements for quarantine, that you're recognizing resident choice and those other needs that need to be met. So are you maintaining the same standard of quality health care? Are you enabling residents to stay in contact with their caregivers, family, and friends while in isolation? Are you ensuring residents continue to have a voice in their care while they're in isolation? Still have choice. Are you providing the patients mental health and well-being while quarantined? Are you giving the residents opportunity to stay mentally and physically well? Entertainment options, outdoor access if possible, ample space to move and stay physically active. We do have some resources here if you're looking for some resources to help support those efforts. With that, I'll pause before we head into the portal training and see if anyone has any questions around the changes that are in the application, the new measures that we have, anything we can help to best set you up for success as you head into this application period here between now and the end of February. So we'll look into the chat or for hands to raise. Okay, well, seeing none, and this is not your only opportunity. If you think of others later, don't hesitate to reach out. Certainly don't wait till February 27th to reach out. Let us know what questions you have as early as you can. We'll be happy to help. With that, I'll turn the floor over to friends and colleagues at the Public Consulting Group to take you through user training around the portal. Make sure you're set up and confident as you use the data collection tool in the portal to enter your application. Zach and team, the floor is yours.
Cool. Thanks, Matt. Can you see my screen now? I think I stole it from you there.
Yep.
All right, cool. Yeah, well, thanks, everybody. Thanks, Matt. Yeah, so like Matt said, We are a public consulting group. We are the department's contractor for helping to administer the Pay for Performance program here. And we've been working with the department for a number of years now. And as a part of this application, I know if you all have been participating in the program for a while here, you might remember that it used to be a paper-based application where you could mail a bunch of documents in a binder into the state or into PCG, and we would evaluate those. But now we have what's called the P4P portal here, where it's really looking at that application and taking it and making it a little bit more electronic and user-friendly. We have this portal that incorporates that entire application. There's tools that you can use to enter your data, upload all your files. So we're just going to walk through that. Relatively similar to what you have seen in the past, but we do have some new features that we've implemented. So definitely want to highlight those. Pretty excited about introducing those. I think it should kind of make it easier for folks to use going forward. So just in terms of agenda, we'll go through some of the login page, how you can get logged into the portal, the home page, kind of what's available on there around your facility information, managing users, actually completing the survey. So going into the completion summary, the actual measures themselves. Like I mentioned, looking at some of the appendices and tools, how you can access those, use the appendices as some resources and enter your data into the tools. And then also just looking at the file upload process, have some, obviously how you can do it, and then also some recommendations for best practices for naming conventions, things like that. We'll go into how you can submit the actual application once you've completed everything. And then we'll do a live demo, just walking through some of the different areas there, particularly some of the newer things that we've incorporated here. And then we'll kind of just wrap up at the end after the live demo. So logging in your first time, we have these circled, but if you've ever logged into anything ever, it should be pretty straightforward. Entering your username and your password. Your username will be your email that you gave us. So we always keep that consistent there. And if it is a new account, you'll probably have the password P4P 2023, but you will receive an auto-generated email stating that when your account gets created by a PCG admin here. If you've had a previous account, your password should roll over. So if you have that saved on your browser, should be able to jump right back in. But definitely let us know if you forgot the answers to your security questions, or you need us to reset something else there. So we'd be happy to do that. The link is right here. Also available if you've ever received an email from us, in our signature below, and it's also available in the guide that we've published as well. But again, if you have trouble accessing, definitely don't hesitate to reach out to us. The first time that you do log in, right, if you didn't roll over your password from last year, you will have the temporary password. So you'll have to go through, enter that temporary password, set up your new password, and then also security questions. So pretty standard use like a regular website here. And once you go ahead and do that, you will just receive notification that that's been set. If you click continue, that'll bring you actually into the application portal there. Once you are logged in, you'll be able to choose the appropriate reporting year that you want to take a look at. There'll be a note there. This is always updated for what the current year is. In this case, it'll be 2023. So if you select that from the dropdown, click the choose button. This will bring you into the prerequisites page. And Matt was covering that a little bit of what we're looking for in here and just how that's changed. We've added a couple of different questions on here. But basically, you just have to attest to a couple of things first around survey requirements. Well, I guess it's both survey requirements, the state survey, and then also a resident family satisfaction survey. We're looking to collect some data around that. So your daily census, the number of residents and families that you've contacted, the number that responded, and then also the name of the vendor that's administering that survey. And like Matt was talking about, these are the kind of additional data collection points that we've added in here. So who is administering it, how it's administered, and you do obviously have to select yes to be able to pass through that. we'll go ahead and independently validate the CDPHE stuff as well. So we'll let you know if there's any reason that you would not be able to participate due to any of the tags that might have come up. But once you select yes, entered in this information that's required in the check boxes and the text boxes, we do also ask that you upload a copy of the survey. There's some additional detail in there around what's required for that. But once you do that, you'll go ahead and be able to proceed to the homepage and the application there. Matt, I see you had a point there.
Yeah, thanks, Zach. And I just want to, reiterate for folks around the tags. We've had a lot of questions around, hey, I had an infection control tag last year. Those codes aren't listed. Make sure that you go into that, Excel application. We do have an appendix that shows you kind of a table of the ranges of tags that you need to not have in order to be able to participate in the program. So make sure you look there. And if you do have a tag like infection control, for example, if the tag you have is not in those ranges, then you're okay to participate. So just make sure that you look there in those ranges, and that is an appendix included in the application. And Tiffany, I see another question there. Go ahead. And you may have to unmute or include your question in chat.
Yeah, I think I saw you said they're looking for a copy of the survey itself, and not necessarily of the survey itself. We're looking for a summary report. Again, as long as that summary kind of identifies these points here, who is the vendor that's completing the survey, and attaching some of those kind of, again, in most cases, you can provide it just kind of showing some high level details, to support these figures that you're reporting here around the number of families contacted, residents contacted, that kind of stuff, and some high level results. That should be good.
Yeah, it's a great question there, Tiffany, and I think that we want to clarify that. Yeah, we don't need you to submit like the survey and every respondent that happened and every question and every response, but we do want that every survey tool that we're aware of has a summary of kind of how many folks entered, what kind of the rate with responses were. So we do want a copy of that summary page of your survey. So great, thank you for that question. So folks, just make sure not necessarily a full-blown copy, but we want that summary. A copy of that summary information.
Awesome. So yeah, like I mentioned, once you do complete the prerequisites, you'll go to the homepage, which is going to be the landing pages for all of your subsequent logins there. Important note here, we mentioned this in our email blast, and you'll also see in our updated training documents. You are able to complete applications for multiple facilities now, and a home can also have multiple users with the ability to complete its application. So this drop down here is going to be more relevant than ever, obviously, if you have access to multiple facilities. So you will need to select the one that you want to use on the drop down in order to get these links to populate here as well. And the same will be true even if you only have access to one home. You do need to just select this drop down in order to get these pages to populate. But it will be obvious because these won't be populating, and it'll say please select in this drop down. So as long as you select the appropriate facility there, you'll be able to access any of the pages there. Another kind of note here, we did update the names just of a couple of these. The functionality of the facility information management is not really any different. Just updating some provider numbers, we can update provider numbers. You can update addresses and other kind of phone numbers, contact info there. The user management page, we'll definitely cover that in some detail, where you can actually, as a P4P user, add different users to your facility's accounts. So for whatever homes you have access to, you'll be able to add folks to that, and you don't need to come to us in order to do that. You still certainly can if you want to, but you'll be able to do that on your own should you want or need to. The participant completion summary is how you get into the application itself. We'll cover that in some detail, obviously, as well. And on your first login, you won't see the confirmation and submission page, but we do just show it in this example here. But this is really where it'll show up once you completed all the applicable P4P measures, and then this is where you can attest and do your kind of full submission there. There's also some reports that are available to you, not necessarily relevant at this time, as it's mostly just looking at your application summary and reviewer scores as well. So like I said, we renamed this page. It's now called Facility Information Management. On here, right, you won't be able to do that much as a facility level user, but the admins can change, your facility name and IDs, provider numbers on this page. But in order to update your facility address or phone number, you'd want to come to this page, and we do ask just at the beginning of, each year, just validate that that information is accurate. We use that for just taking a look at some of our on-site stuff, when we're looking to do those. So we have the locations of all the facilities. And obviously, should we need to escalate anything, having a phone number handy is good for us as well. Once you change that, if you click the update participant information, that'll lock those changes in and save that. So the user management page, like I mentioned, will look a little different this year. This was previously just on the provider information page, but now since we have the ability to add multiple users to each home and you can access multiple users, this is where you'll be able to do that. So on the user management page, if you go to this select user dropdown at the top, you can select add new user. The only two options that'll be present in this dropdown are your own username, where you can edit some of your own information, but also this will blank out everything in order to add a new user. So you can add, the person's name, their contact info, position, and then you'll have to assign a temporary password yourself if you're creating this account. But typically we just, you can really make it anything you want, as long as you don't necessarily even have to tell them, I suppose, because it will auto-generate an email for them. But just as a best practice, we always just make it P for P 2023. And that'll allow you to create the account for them. You can select the associated facilities here. So the only ones that'll be present in this list are ones that you currently have access to. So if you do need someone to have access to another facility that you don't have access to, you will need to reach out to us to do that. But if you want them to access anything that you're already on, you can definitely do that on your own. I see you have your hand raised again there, Matt.
Yeah, thanks, Zach. I think that was really important that we went through that, so I don't want to dismiss that. But I did see a question come in that's also one we've seen in years past around the prerequisites. Sometimes folks aren't going to have some of their information until after they want to already kind of get in here in December and work through their application. And I think we have some best practices around that, right? Because it won't let you move forward unless you fill in the information, right? And so maybe speak to that. And I think really we're looking for kind of your average daily census, I think is what most people are really concerned about. And I'm like, well, I'm not going to know that until I get till the end of December. If you are in a position where you're ready to start your application, that average census between January and November will be just fine. We generally don't see statistically significant changes in average census by adding one more month's worth of average census in there for the month of December. And we're not using this as a performance measure. We're just trying to keep that accurate. So if you feel like you're ready to rock and roll in your application, you're not going to wait till January. You're ready to go now. Just put in those averages from through whatever date you begin the application will be just fine. Zach, anything you would add to that?
Yeah, and I would say the same thing. It's not going to change. It shouldn't change that much anyway if it's just January through November. But if for whatever reason it does, or you do want to update it, you can just shoot us an email and we can update it on the back end. So again, same thing with the satisfaction survey results. If anything changes in the last month and you've started it already, just let us know. We can update those fields on our end.
Yeah, that's great. Does that help, folks? Any additional questions there? And Amber, yeah, great question. No, you are not. So once you kind of complete your prerequisite question, that kind of locks it and opens the application for you. So you can't, go back to that. And that's why if you put something in and you feel like it's changed enough that you need it changed, send us an email and the team will just update that down the back end if you need to get into there sooner. So if you need to start working here in early December, use the data that you have based on everything up to the date you start, which will be fine. And if you feel like it's going to change a lot in December, then just reach out to us. We'll update that for you. But you will not be able to go back in and change that yourself. Thanks, Zach.
Cool. So yes, let us know if you have any other questions on that. But right, if there's anything that needs to be updated, just using our email, we'll be able to get that done. So on the participant completion summary, this is kind of that third option, and really most important option on the homepage. This is where you can actually go in and complete your application. So this is what it'll look like here. Right, it's showing all of the different measures, the subcategory names, the measure IDs, what the measure is actually titled, whether it has a tool or appendix associated with it or not. So right, in some cases, with the QAPI measures here, there's an appendix that would be a resource for you. So if you click into there, you'll be able to access that. But for some of the other measures where there's maybe a tool associated, not necessarily in the quality of life measure, but in the quality of care measure, it's more pertinent there. Well, where you'll have to enter some data, just letting you know that there's a tool there. The number of points that are available for each of these measures, most of them are all or nothing. But the self-score will start populating once you go in and start entering your information into there to let you know how many points you are assigning as your self-score. And then you can see documentation uploaded as well. This will check if you have uploaded at least one piece of documentation to that measure. We'll obviously cover how you can upload the files as well. So if you click into a performance measure, it'll bring up the specific requirements. We call them minimum requirements for the measure here. You have the option to select yes, no, or not applying in each of the minimum requirement dropdowns. Yes is basically saying that we've reviewed these application requirements here, and we believe that the piece of documentation or the data that we've entered meets the requirement, meets the criteria here. If you select no or not applying, that basically serves as acknowledgement that you're saying, we do not meet the criteria, or we don't intend to apply for points for this measure. So no and not applying do the same thing from a scoring standpoint. Like I mentioned, most of these measures are kind of all or nothing. So unfortunately, if you don't meet one of the requirements, there's a good chance that you're not going to be able to meet, you're not going to be eligible for points for this measure. The not applying, again, really just kind of, serves as an acknowledgement. It's another option. We don't intend to apply for this measure. We're not going to upload documentation here. But once you've selected yes, like I mentioned, from these drop downs, it should populate the self-score there, which will show, 3 points available, and your self-score is 3 points here. Again, it'll auto-populate. There's not anything that you need to do. You don't need to enter 3 for the points available. That'll populate on the sidebar here, and then it'll also pull into the summary page. And obviously, that'll all total up and show what your self-score is on your application. There's also a couple of different buttons at the bottom here. There is a save button that'll allow you to save your progress here, your responses, and remain on the same page. If you click previous, obviously if you're on measure 2, that'll go back to measure 1. If you click next, that'll go to measure 3. The summary will bring you back to the participant completion summary page, and you can kind of navigate to whichever measure you want to there. Right, if you're completing this kind of linear, you can just click next, 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 and keep going through. But if you want to jump around, you can go back to the summary to navigate to additional measures. The save button really is only used if you want to stay on the same page. But if you click any of these buttons, it will save if you leave the page in any fashion. And I just said that, so it will save. There's a couple of different kind of colors that your measure will be in. There's a color coding system here. Right when you first log in, after you complete the prereqs and you go to that summary page, all the measures will be blue. And this means, right, it hasn't been completed. There's no self-score assigned. So it's waiting for you to go in and submit your responses and documentation there. If it's green, it means it needs a reviewer score, which means the self-score has been assigned. So you can see that for the enhanced dining measure that we completed there, where we submitted all the responses and selected those drop-downs. So that means it's waiting to be reviewed by the PCG reviewers. Once it gets into the orange, that means it has been reviewed. PCG has evaluated that measure and assigned a score for you there. And the gray, not present on here, but really just like Matt was saying in the beginning, right? We do collect data for 8 of the quality measures, but only 5 are scored. So the ones that are a gray bar just indicate those that have been excluded. So we're taking the top 5 scores of 8. So there will be 3 of those that'll be gray. Mentioned this also, but this is a better demonstration of it here, just showing the tools and appendices. Right, there's tools associated with all of the quality measures, with antibiotic stewardship measure, Medicaid occupancy, staff retention, DON retention, and your nursing turnover rate. So this basically just indicates that when you go to that page, you will see a tool or an appendix there for you to complete. Right, when you click into those, you will see it available on the right side. This one, as an example for the QMs, has an appendix, just giving you some resources, some more context and information there for, what you might need to be including as a part of this measure. And then you can also click the tool, they're labeled separately. And this is where you'll actually enter your data. So in this case, right, it's entering your QM scores from your quarter 3 and quarter 4 2022 CASPER reports. But we're definitely going to touch on this more at the end and kind of reiterate this as well, but really trying to push folks towards using the tools that are available in the portal. Kind of allows us to do some reporting out to the state, looking at kind of, both this year's data and, longitudinally as well, as we have that available. But also really ensures kind of consistency of data also, and ensures that we're getting what we need from you all, because right, we do have the Excel tools, but a lot of the times we just get a PDF of that, or sometimes it's handwritten. So using the tools in the portal really ensure kind of data quality, and also allow us to do some reporting on there as well. But again, we'll touch on that at the end as well. So for uploading files, right, I would say 99% of the measures do require you to upload some sort of file, either in addition to the tool or just to meet the minimum requirements there. If you click the file upload button at the top of the page here, it'll bring up the pop-up and allow you to start uploading some documentation there. You can upload multiple files at once. However, it's got to be associated with the same performance measure and minimum requirement. So right, you'll be able to go through, select which performance measure you want to tie it to, which minimum requirement specifically, and then you can choose your files. If, like I said, if you're uploading it to the same minimum requirement, you can select multiple files from that to upload at the same time, or you'll just kind of have to go through and do it one by one. To avoid potential loss of points, make sure that it is tagged to the appropriate performance measure and minimum requirement. Again, this is another thing that we'll touch on at the end, but really looking for folks to upload, things to minimum requirement 1.1, 1.2, 1.3, 1.4, et cetera, instead of uploading a batch of files to just measure minimum requirement 1.1. Sometimes things are labeled in that batch, but, in order to make it as, clear as possible for our review team, we really ask that, we have it for a reason set up so that you can tag it to the minimum requirement. So there's kind of no room for interpretation or anything like that. We know exactly what we are looking at. This is the document for 1.5, and there's kind of no room for us to misinterpret anything there. So on the file upload page here, once you do go through, and tag it to your specific minimum requirement, choose your file, click the upload button. You'll get a notification your upload was successful. Should you need to adjust anything there, you can click the edit button on the side here, and that will allow you to adjust any of these fields. Obviously won't be able to adjust the document name, but you can, if you meant to do it to 1.2, you can just click the edit button and change your minimum requirement to 1.2. And you can also adjust the notes at any time as well. If there's anything that you want our review team to see, you can add notes in there. Or if you want to do it for, your own internal purposes, grab this file from the XYZ report. You can certainly include that there if somebody else will be completing it next year, or you just want to keep that for historical purposes. You won't be able to upload files with the same name. So we just ask that you rename the reports, to measure 18 and 20.2, just including that in the title if you're going to use the same file for that. Again, touched on that with editing. But in terms of some naming requirements, best practices, we do ask that your supporting documentation be organized, clearly labeled, and as easy to navigate through as possible. If you are doing what we just talked about with uploading to the specific minimum requirement, that should kind of take care of itself. We should be able to identify things very easily if it's tagged to the appropriate place. We also ask that, if you're uploading, a huge report, maybe multiple pages, highlighting is great. Even putting some handwritten notes on things is great as well, just to really draw attention to what the reviewer should be looking for there. We do have the appeals process, which we'll definitely talk about, down the line. And that's where you're able to kind of, contest any results. But in order to avoid that, if you could just be as clear about things as possible up front, definitely appreciated from our end to make it as clear as possible to the review team. But in terms of, uploading files and naming, you can use the measure ID, measure name, document description, kind of separated by underscores there to upload your files. Right. So in this example, measure 01, enhanced dining menu cycles. That's very clear to the reviewer what they should be looking at, what that document would be. And so, definitely would be appreciated to try to keep things as consistently and clearly named as possible there. So the confirmation and submission page will appear once you've completed all the measures in the application. If you click on that, it'll bring you to a provider signature and submission box. You can just enter who's kind of signing off on this application, really just saying, I've verified or validate that all the information that's been submitted here is complete and accurate, and I attest to, this application. So you enter your name, your title, click the confirmation checkbox, and click submit. Once you do that, your application is going to be locked, and you won't be able to make any changes. If you do this, ideally, we ask that you try to get this in as early as you can before February 28th. But should you need to make any changes, if you realize before the deadline, we can definitely unlock it for you. But right after the deadline, February 28th, you won't be able to adjust it, unfortunately, once it is locked. So, and you should receive an email as well, just indicating that it's been submitted. So that'll let you know that PCG has received it. Matt.
Yeah, Zach, can you just touch on again? So I'm completing the application. I'm in there under the kind of the survey tab. I get to the last question. I finish it. It's not going to take me automatically to here, correct? So can we just kind of walk through that step one more time for folks? So I'm in my survey. I complete my survey. I need to go back out to the main page, and you're going to have a new button that's going to appear. So that's the thing, folks. So you think, I get it. I've been there before. It's like, I do it. I've done it on things before. I'm like, okay, I finished the last question. I'm done. Wipe my hands. I'm done. Close it out. Go to dinner. You're not done at that point in time. So you have to get back to this main page. There's a confirmation and submission button. You have to go click that to get into the actual confirmations process. Zach, can you talk us through that maybe just a little bit more?
Yeah. So once you do complete the last question, if you click the homepage button, if you click the summary button, well, the summary button will leave you and bring you back to the application summary there. But if you go back to this homepage, you'll notice that this new button will appear here. Once you click on that, that'll bring you into your application summary here. And this is not different. So those who have participated in the past, you will have done this whole process before. But we can certainly let you know. That's something that we check for kind of throughout the process here when we're just doing, status monitoring. If it looks like somebody's completed their application and you haven't completed the submission or the confirmation, we'll definitely reach out as it gets closer to the deadline just to make sure that you didn't miss out on that. But once you do that, you should receive an email just letting you know that your application's been submitted, and that'll kind of, let you know there's nothing else that's needed at this time. And that kind of kicks off the review process there.
Great. Thanks, Zach.
So yeah, live portal demo here. Let me just get logged in. I should be able to just pull this over here. You see that, Matt? Cool. So yeah, so this I just logged in with my my test account here. So this should look pretty similar to the screenshots that I was just showing, but this is where you'll land when you first log in. You'll have this drop down here to select the application year that you want to go into. In this case, like I said, 2023 is the current year. If I click choose, right, you need to select a provider if you want to click participant completion summary to proceed to the application. But in this case, if I go, I think it will be available for this one if I remember if I did this correctly. Yes, I did. So this is for one facility, right? In this case, you can see I have access to two separate providers. So I need to select which one I want to use. In this case, this provider has already gone past the prereqs and it can access the facility information management, user management, participant completion summary. But this provider hasn't completed the prereqs yet. So this brings me to this page here. Like I mentioned, I need to select yes on this, enter some data for my census. We contacted 20 residents and we heard back from 10 of them. Vendor is test vendor. Right, this one is asking who is administering it. Is it the vendor, staff, home's internal staff, or other? If you do select other, you will be required to enter some details into here. Say test. It's a radio button, so you can select all that apply, including other. But once you do this, you can scroll through, kind of just read some important notes on this. Just some details. This is all present in the Excel version of the application as well, just discussing some of the scoring criteria, etc. And then if I click submit prerequisite answers, this will now bring me for this facility to the home page here. Like I mentioned, we have the facility information management page. You can't really enter too much here. In Denver, Colorado. And the phone number is that. But if I click update participant information, this will lock this. And if I go back to the home page, we'll see that that's entered there as well. So just best practice, if I know the facility names are changing all the time, if there's any locations that have changed or the, phone numbers for whatever reason, if your mailing address has changed, definitely let us know. You can update that. Well, I guess the address you can update yourself, but if the name has changed, definitely let us know that. I know there's been a lot of shifting around recently. So on the user management page, like I showed, right, the only two options that are in here are your own username. You can enter, you can change your name if that's incorrect for whatever reason, the contact position, the contact phone number, extensions as applicable. You won't be able to change your user role, obviously, because the only other option is an admin. But should I want to add a new user, I can make this person, call it Matt Haynes. phone number, and then assign the temporary password of 23. And so, right, so I am able to assign Matt Haynes at PCGUS any access to any facilities that I already have access to. So it can be one or both. And if I click that add new user button, that'll add Matt successfully and should trigger an email to his fake PCG email and should tell him his temporary password, and he'll be able to get into the system, go through that same process like we talked about before with setting the permanent password, security questions, and then he'll be able to log in and have access to these two facilities. If there's someone in your, if there's a larger organization and you don't have access to the specific facility that they need access to, again, that's something you'll have to come to PCG for. Or in turn, if you need access to another facility, let us know and we'll be able to adjust that. So on the participant completion summary here, I'm on test PCG, right? And you can flip back and forth between your different facilities. If you click view selected, right, these are going to look the same right now because I haven't completed anything for either of them. But you are able to flip back and forth on this page and getting into the different facility accounts. Going into one of the measures, right, in enhanced dining, this is what it looks like when you click into here. Right, these are all going to be blanked out, and you'll need to select, you can say, yes, I am meeting the requirements here. Or if you don't meet the requirements for one of them, you'll see a no. But right in this case, because there's one no selected, you'll see that the self score is 0 and the points available is 3. But if I change this one to yes, it populates the self score of 3 there. To upload some documents to this page, I can click the file upload button at the top. Right, if I want to upload this to enhanced dining, minimum requirement 1.1. Oh, I guess I have to click choose. I have to choose a file first. Hold on. Now it froze my computer, so hold on. There it is. Let me just select a file here. I will upload this Excel file. And then if I click upload, we'll see upload successful. That it uploaded this random file here to minimum requirement 1.1. If I do click edit, right, I can change the measure or minimum requirement that I tag that to, and I can add some notes here, and I can click update, and it'll update that file. I don't believe it shows here immediately, but if you do leave this page and come back to it, you have to get it to refresh. But you will be able to see the documents that you've uploaded associated with this measure at the bottom here. So right, ideally, you should have a file associated with each one of these minimum requirements. And right, that should be obvious to you if you're doing your check at the end. Right, I can go through and validate that there is a document that I have tied to each of these minimum requirements here. You'll see right as I'm moving around, the record's been saved each time I go through. Whether I'm leaving the page, well, I guess, right, I'll show you if I go to next also, the record gets saved again. If I go back to previous, still gets saved here. You'll see, right, the tools and appendices that are associated with each of these. I'll go to the quality measures here. This is an example of one, right? It's a little bit of a different measure where it's not just yes or no. You do have to say, yes, I'm uploading my Casper quality measures to this, or copy of my Casper reports. And then you have to select which range you actually fall into. So in this case, if our score was less than 2.41, we would be qualifying for the 4 points available, and this aligns to the percentages that Matt was saying earlier. But there is the QM tool associated with all of these. And this will show you, it does an auto calculation of your 2-quarter averages. So if you have your Casper report available from quarter 3, and yours was 4.0, and in quarter 4 you were 2.0, You click Save and Calculate Points. That shows you that you were a 3. And right, you do fall into this range of greater than 2.41, but less than 3.08. And that shows that you are eligible for these 3 points here. Sorry, I don't know why that wasn't populating there. Now it's 3 points. If I go back to the summary here, right, my points are starting to total up now. Right, I had 3 points from the enhanced dining measure that we just entered before, and then 3 points also from the quality measure that we just completed here as well. You can go through and complete all of these, all the tools. I can show another tool that we have used in the past, the staff retention improvement. Right, if I was going to go through and complete this measure, I would go into the tool first, and I would enter some of my my home's data. So the total number of employees that were on the payroll at January 1st, if that was 20, and we'll say, I guess in this example, I could say 10. So say we had a 50% staff retention rate. If this number is not greater than 60%, right, you're still eligible for points because you can complete the staff retention improvement calculator here at the bottom, right? So in this case, my staff retention was 50% for the P4P performance year. And we'll say last year it was 45%. So we did improve by 5%. And if this number is greater than 5%, then you are eligible for points in this measure. If you click Save, that'll let you know that your information is saved in there. If I go back to it, it'll show that it's still there. But right, so I would say that I completed this and we were eligible for points based on the information that I had entered there. I'm not going to do that, but I'm going to include a copy of my payroll roster and just highlighting, anybody who was hired on or before January 1st of 2022 within that. I would also say that I'm not applying for the QAPI recovery point. I guess we didn't necessarily touch on this, but these, I believe we had them back last year as well. It won't really impact anything if you're saying yes to all of these. Even if you say yes to this, it doesn't change your score at all, regardless of what you're doing. But right, in this case, if you weren't eligible for this measure based on the data, or eligible for points on this measure based on the information that you submitted. So say I said, no, we don't meet this, so I didn't provide this. You still can get the 1 QAPI recovery point if you're able to demonstrate, that you had a QAPI project that was related to staff retention in 2022. But again, if you say no, I don't have that, you don't get points for that. So the only places where you are eligible for partial points on the measure is going to be the quality measures, which are, where you can score based on the different tiers there, the percentiles, and then any measure that has a QAPI associated with it, a QAPI point associated with it. Again, asking that everybody complete, well, I guess nicely asking, but also requiring that everybody complete the tools that are in the portal this year, again, for the reasons that I mentioned. If you're uploading an Excel version of this tool or handwriting into the versions that we have available online, or on the department's website and not completing this tool, we can't, people have lost points for not completing this correctly, and we're not really able to do any reporting on it. Some interesting data that we're getting in here, obviously, around staff retention, staff turnover, things like that, quality measures. So important that we have that data available so that we can do some reporting on it. Anything else you think is relevant to show, Matt?
No, I think that was really good, unless other folks have any other functionalities that they would like to see us work through.
Awesome. Let me see if I can gracefully bring the PowerPoint back up. All right, that was better than I thought. So yeah, Matt, feel free to add anything onto this, but this is kind of some of the stuff that we're talking about here with the changes, to kind of the process of the application we're looking for, particularly on number 2 and 3 as related to the portal. We are going to require that you use the tools that are built in here, like I mentioned, to improve the consistency and quality of the data that we receive, as well as our ability to report out on the data that's contained in the tools there. I think that's really important. And additionally, we're asking that you upload specific data to specific minimum requirements, documentation to specific minimum requirements, right? Batches of documentation that are just uploaded under a single minimum requirement leaves a lot of room for interpretation from our review team. And if you're uploading specifically to, and tagging it to that minimum requirement, we know exactly what, you're intending to submit for. And it makes it a lot easier on our end to just not have any room for interpretation there. Anything else you want to cover there, Matt?
Yeah, I'm just going to underscore a lot of those things, folks. I mean, these are best practices of what we need to see in terms of your submissions here. Again, evidence, when it says evidence or documentation, that evidence is something more than just a narrative. So particularly around like volunteer programs, did you have sign-in sheets or flyers that went out, something that shows that, those things happen, that evidence. And I think that, Zach really hit on this hard, but I want to underscore it again. Use the portal's tools. That one, it does error checking for you to make sure that numerators and denominators aren't flipped. And it allows us to be able to pull that data into our data warehouses for data analysis around the program and for, taking one more step of user error out of there in terms of manual transcription. And then the documentation piece, we have seen it. We have seen it where homes have, doing enhanced dining or some measure where there's, 4 or 5 minimum requirements that all require documentation, and just submitting the entire packet of documentation to that first minimum requirement. And then our teams are on a treasure hunt to try to find out which ones for which minimum requirement. And sometimes we miss those. So to avoid that, upload discrete documentation for discrete minimum requirements that require documentation. In addition to that, if that document itself for that minimum requirement has multiple pages, but only like one paragraph on page 2 really hits on that minimum requirement, highlight that, put an arrow, type it in the notes. Hey, review team, the documentation for this minimum requirement is contained on page 2. Anything you could do to take out any type of treasure hunt that the reviewers have to do is in your best interest to make sure you're directing them specifically to the evidence and documentation that you have to meet that minimum requirement. And then just making sure you're uploading those. Sometimes it's like, well, it's the same document for that as another measure. Well, then upload that again and just rename it. It may feel like, it's just ones and zeros really at that point in time, and it's much easier to make sure that our team is clear on, I'm answering this question. Here's the documentation for this minimum requirement. Just set yourself up for your best success in terms of our scoring, cut down on needs for appeals and reconsiderations, and make sure that we give you the credit for all the good work that you're doing. So with that, any other questions that we could help? Portal questions, requirements around the program, anything before we conclude today? Feel free to type those in the chat. Feel free to raise your hand. We allow you to unmute and ask a question verbally if you feel more comfortable doing so there. Okay, going twice. Let's talk about our key next steps. So the portal did open on the 1st, so it is available for you. We're holding that training session here today, wrapping this up. We'll be posting this to the website afterwards as well, as once we get the recording cleaned up and edited. February 28th, 2023 is the deadline. Don't miss that. Make sure that you're in. Also, if you have any questions or have any concerns or run any troubles, whether it's portal, technical assistance, questions about documentation or the program, ask early. Do not wait till the day before the deadline, because if we don't turn around that assistance in a day, in a business day, and we're trying to get that done, you miss the deadline, you're going to be late on your application. You don't want to be there. Ask early, ask as often as you need to, make sure you get the help you need. We'll do the reviews during the month of March. We'll actually be conducting our on-site reviews during April. And then we will we'll release the results out to everyone on May 1st. At that point in time, that'll open the appeal period for anyone to request reconsideration where they think we may have been scored in error. And that'll last the entirety of the month of May. And then we'll finalize scores and be ready to pull those into the model for your supplemental payments beginning July 1st. If you have program-related questions, please reach out to me directly or Richard Clark as well. We're happy to help you. If you have portal-related questions, technical assistance, reach directly out to Public Consulting Group at Colorado Pay for Performance at pcgus.com. And I know as we're getting close here, I know that I will just put a link in here, some information around the racial health disparities webinar that is going on currently. Just started at 12 o'clock. You may be able to catch the rest of that. I think they'll be recording that, making it available afterwards as well. And then going for the third time, any other questions that folks may have before we adjourn today? Well, thank you so much for attending today, folks. We hope we found this valuable and helpful. Help you best set up for your best success in the Pay for Performance program. Thank you for all the hard work you do around implementing these programs and this particular program into your homes. Thank you all for what you do to keep folks well, safe, healthy, and thriving in their homes. Do the same for yourselves. Take care, everyone. We'll talk to you again real soon. Thank you so much.